Hello everyone. I'm Randy Murphy, epidemiologist and the Director of Disease Surveillance here at the Mobile County Health Department. Our health officer, Dr. Kevin Michaels, is traveling today, couldn't be here. He's been closely paying attention to the events of today and yesterday. I'm joined today by Dr. Stephanie Woods Crawford. I'm the Executive Director of our Prevention and Wellness Division. Today, in conjunction with the Alabama Department of Public Health, we announced the first case of monkeypox in an Alabama resident. This patient is a Mobile County resident who sought health care earlier in the week and met the epidemiologic and clinical criteria for testing at the Alabama Department of Public Health Bureau of Clinical Laboratories. We received the positive result late yesterday afternoon and immediately began our investigation. The patient's behaviors, opportunities for exposure, including in other states and in Mobile County, the illness onset date, the rash progression, age, sex, and other risk factors fit the patterns described nationally. The patient had no known contact with a monkeypox patient, so did not know if they had had skin-to-skin contact with someone who had monkeypox, which emphasizes the importance of raising awareness for our community in general, but in particular, raising awareness for our healthcare community and those that are at most risk for infection. So what are we doing? It's an ongoing investigation, so our investigators are monitoring the patient, identifying close contacts, contacting and monitoring anyone who had close contact with our case patient, and this will continue for several weeks. Earlier in this week, our health officer, Dr. Kevin Michaels, worked with the Alabama Department of Public Health, the Centers for Disease Control, and the Strategic National Stockpile to complete the paperwork necessary to enroll Mobile County Health Department and the infectious disease physicians in Mobile County in the investigational new drug protocol that's required by the Strategic National Stockpile for the use of the antiviral medicine TPOXX for patients who may benefit from this treatment. Jynneos is a vaccine that is also in the Strategic National Stockpile and authorized for post-exposure prophylaxis for people who have high risk or moderate risk contact with the case patient. Both of these therapeutics, both TPOXX and Jynneos, have been requested from the Strategic National Stockpile, and we will have them tomorrow. So as you know, monkeypox is not endemic in the U.S. and is only naturally found in Africa. So I just want to review a few things about the monkeypox outbreak that's happening right now in the United States. Remember, it's a disease caused by the monkeypox virus. It's not commonly seen in the United States, and it can cause a rash which might look like pimples or blisters, and it's sometimes preceded with a flu-like prodrome. So you may have fever, may have achy muscles, you may have swollen lymph glands either in your neck or under your arm or in the groin area. It's spread through direct person-to-person contact, usually close contact, often requiring skin-to-skin contact. So if you have directly touched a monkeypox rash or scabs or body fluid from a person from monkeypox, that's the most common route of transmission when it's from human to human. Also, touching objects like clothing or bedding or towels and surfaces may be a route of infection for monkeypox. And also sharing respiratory secretion, close personal contact, face-to-face contact. So that's normally how monkeypox spreads person to person. In the current outbreak, the contact can happen during intimate contact, including oral, anal, or vaginal sex, touching the genitals of a person with monkeypox, hugging, massaging, and kissing, prolonged face-to-face contact with someone who has monkeypox, and again, touching fabrics and objects that were used during sex by a person with monkeypox that has not been disinfected. So symptoms of monkeypox, again, it's looking very typical, although the rash is a bit atypical. So you still have a few of those prodrome symptoms. So you may have fever, swollen glands, may be tired. Not all people have this though, so it's possible to just get a rash and have none of those flu-like symptoms. So the rash may be located near the genital region, but can also be on other areas like hands, face, shoulders, abdomen, and the rash will go through several stages, including scabbing before healing. So if you have monkeypox and you have rash, you will not be considered healed until the scabs have fallen off and new skin has grown where the sore once was. These may be blister looking, they may be itchy, they may be very painful, and they may also be seen in mucous membranes like the mouth, also in the vagina or in the anal area. So let's talk a little bit about what we can do to lower the risk of monkeypox infection. So again, you want to avoid skin-to-skin contact with anyone who has symptoms of monkeypox. Usually the rash is the most obvious symptom, or you want to avoid skin-to-skin contact with anyone who's been diagnosed. So please, raise your suspicion of monkeypox if you have partners or if you have a rash on any part of your body, whether or not you think you've been exposed to someone with monkeypox or not. So if you do have a new or unexplained rash or other symptoms, what we want you to do is to avoid intimate contact or avoid sex with anyone until you have been checked out by a healthcare provider. If you don't have a healthcare provider or health insurance, don't worry. You can seek care here at the Mobile County Health Department Clinical Services Division, Family Health. When you see the healthcare provider, so when you go in, if you have a rash, you need to cover your rash. So wear long sleeves, long pants, maybe a hoodie if you have skin sores on your skin when you seek health care, and make sure that you let the provider know that you have a rash and risk factors for monkeypox. We also want you to avoid gatherings if you have symptoms of monkeypox or if you have been exposed to someone with monkeypox. So, particularly if they involve close personal skin-to-skin contact. That's what we're trying to get people to avoid. All right, so let me just wrap up by my remarks by saying that, at Mobile County Health Department and Family Health, we provide open door services and welcome our entire community, regardless of age, race, sex, gender, politics, gender identity, or sexual preferences. And we're determined to provide high quality, culturally diverse, and preventive health services to everyone in our community, including those who identify as LGBTQ. No one should face challenges when it comes to their primary health care, and Mobile County Health Department and Family Health are ready and available to provide services to our community. Thank you for listening and for being here today. I'll take questions first from in the room, and then if we have time, we'll take questions for Facebook.
Do you have any more details about patient, gender, age, anything like that you can release?
So no, I think you guys know that we can't release specifics, particularly when you're the first and the only. It's very, we need to protect that patient's identity. I will repeat though that the age, sex, race, other risk factors mirror that what we're seeing nationally.
How many close contacts have been identified?
A few.
How long does the healing process take?
So the healing process could take 3 to 4 weeks, which is an inconvenience, right, to the patient. So we have encouraged and are continuing to monitor isolation, and so far we have great compliance with our instructions, and we won't be able to lift isolation until the sores have scabbed, the scabs had fallen off, and new skin has grown where there were sores.
After 2.5 years of COVID, do you think people will take this serious, and is it serious?
Well, it's not as contagious as COVID, right? Not as many people are going to get it. It is a self-limiting condition or disease, the illness is, and so there have been no deaths. There have been no cases in healthcare workers. There have been no cases in the United States in children, right? That's all very different from what we know about COVID. So while it is transmitted person to person, it requires that skin-to-skin contact, and we certainly hope people will listen. We're lucky that we have really, our health officer and our executives have leaned forward in being able to access antivirals and vaccine, and we are ready to provide those to our community.
How much of the antiviral and the vaccine are y'all expected to receive tomorrow?
So we have just requested exactly what we need for our case patient and the close contacts. Right now there's, Alabama is in the allocation phase of 2A, which means that we can receive vaccine from the stockpile pre-positioned in Alabama, but anytime we need it for close contacts, we'll be able to get it from the stockpile.
Can you speak to what state you guys think it came from?
Well, our case patient had traveled to 3 different states in the 21 days prior to symptom onset.
Is there a recommended quarantine period?
So for quarantine, it's 21 days. So we ask people to quarantine when they've been in close contact with our case patient, and we're asking folks to quarantine for 21 days. Now, quarantine is different for monkeypox than it is for COVID, right? So for monkeypox, we want people to monitor symptoms, and we'll be monitoring them every day for 21 days, but we don't require them to stay at home. They can still go about the community, but we do ask that they be very careful to inspect for rash and monitor fever and those sorts of things, so that if they do experience symptoms, we can, get them in isolation. You cannot transmit monkeypox until you have a symptom.
How quickly does this spread in communities? Because I know we're not the only state that has this at this point.
Right. Usually, we can stop monkeypox transmission with maybe 5 or 6 cycles, right? In this outbreak, because it's spread through close intimate contact, through sexual contact, often we're not able to identify people who have been contacted. So people may have been at a bathhouse or at a rave or at a party where they had skin-to-skin contact, maybe dancing without a shirt even, with people sweating and that sort of thing, being at parties and, other meeting people on the internet, group sex, anonymous sex. It makes it very difficult for us to identify the close contacts. So that's why in the current outbreak, it's taken longer for things to try to get under control. In fact, I think right now we're seeing that we're a bit behind because of these challenges with identifying contacts and getting vaccine in them. Now, recognizing this, the Centers for Disease Control has changed its vaccine strategy, in that they recognize that in communities with many cases, they're no longer to utilize a ring strategy. So when a ring, I'm talking about vaccinate the people right around the case, right? And they're beginning to make vaccine more available to the affected communities. So hopefully that will help. But right now we're just dealing with this one case. There will be additional cases in Alabama and in Mobile County.
So you use an example, like if you're in a party dancing with somebody chest to chest, and when you get it, does the rash or blister stay in this area, or does it spread over your body?
It can be just in one place. We have seen U.S. patients that just had a single lesion, like on the face, and there have been situations in the U.S. where they've had it all over their body. So it varies greatly, which also makes it more difficult to recognize and get in for treatment or get in for testing and receive treatment. Okay. One thing about testing is that in the last couple of weeks, this patient, the specimens were tested by the ADPH Bureau of Clinical Laboratories. That's the LRN network that's set up for emergencies. But there are now 4 or 5, that number gets higher every day, commercial laboratories that can test, which has greatly expanded the availability of testing. So we want people, if you have a rash, if you think you've been exposed to someone, please seek health care and get tested. There's plenty of testing out there.
Two.
Okay, sorry, one second.
Is a person contagious before symptoms if they've been exposed?
So a person is not contagious before symptom onset. But remember, a symptom might be the rash, it might be a fever, it might be a swollen gland.
Can it be transmitted from toilet seats?
So the question is, can monkeypox be transmitted by toilet seat? Monkeypox virus can live on surfaces. So if if we have someone who's isolating at home, we recommend that they use a separate bathroom and that you disinfect hard surfaces frequently. Did you have something?
Yeah, just what's the main takeaway for the, Mobile County as a whole on this announcement today?
Yeah, I think the main message that we'd like everyone to know is that we potentially have local transmission of monkeypox virus. It is, in our community. We don't want people to be scared, but we want them to be cautious and to be aware that if you have skin-to-skin contact with people that you don't know, it may raise your risk of monkeypox infection. We want you to be safe about that. We support all lifestyles, but we are going to continue talking about having safe sex and having maybe modifying lifestyles slightly until this outbreak is over. And again, we want to talk to our healthcare community about raising their awareness so that when they see people who have some of the risk factors that are known in this outbreak, that they have, that they test them for monkeypox either through the state lab or through one of the commercial laboratories. Okay. Mark says that's also.
How long does it take for testing to come back?
Generally, it's done the same day at the state laboratory. Now, I don't know what is happening at the commercial labs, but through the state LRN, if they get the specimen first thing in the morning, they have results by the afternoon, Monday through Thursday. Okay, thank you all.